Have you ever heard that a heart attack strikes out of nowhere? The truth is, that's rarely the case. Your body often tries to warn you days, sometimes even weeks before it happens. But most people miss those signals or confuse them with something else. In today's episode, I'll show you what those hidden signs actually look like, from the subtle changes you might feel to the more obvious symptoms that should never be ignored, because knowing them and reacting fast can literally make the difference between life and loss. And here's something surprising. Studies show that in over 60% of cases, the body sends out clear warning signs well before a heart attack. So stay with me, because by the end of this video, you'll know how to recognize them, understand what they mean, and most importantly, protect yourself and your loved ones. Before we start, please remember that the information shared in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor or healthcare provider before making any changes to your health routine. A heart attack is often associated with a sudden, frightening event that requires immediate medical attention. We imagine it as something out of a movie. A person with no prior signs suddenly grabs their chest and, of course, collapses to the ground. However, the truth is quite different. Studies show that a heart attack rarely occurs without warning, without symptoms that the body sends, indicating that a heart attack may be near. It turns out that in most cases, the body gives us warning signals several hours or even several weeks before the heart attack occurs. Understanding these signals, recognizing these early signs, can literally save your life or the life of someone close to you. So what should make us concerned? What symptoms may indicate that a heart attack could happen in the coming days or even weeks? Let's start with the more characteristic and obvious symptoms, known as prodromal symptoms, which often resemble those that appear during an actual heart attack. The first and most common of these is, of course, chest pain. According to studies, up to 60% of people who experience a full heart attack within days or weeks report having chest pain beforehand. What is very important to understand is that this pain can vary greatly in both type and intensity. For example, as many as 44% of people report a feeling of pressure or heaviness in the chest. Furthermore, individuals experiencing not only a heart attack, but also the early warning signs of one may feel a burning sensation in the chest, which is unfortunately often mistaken for heartburn. It is also worth remembering that pain warning of a heart attack often radiates to the left arm and may also spread to the neck, jaw, back, or even the upper abdomen. However, I want to especially draw your attention to a sudden back pain that appears without any injury or physical effort. How long does it last? There is no specific rule. It can last just a few minutes or even several hours. That's why I strongly urge you never to ignore back pain, chest tightness, or discomfort in the surrounding areas. Of course, sometimes the cause may be completely different. For example, inflammation of the pericardium or gastroesophageal reflux. However, it is always better to be cautious and consult a doctor if there is any doubt. The doctor should then order the appropriate diagnostic tests. Of course, chest pain and tightness are not the only symptoms that may signal an approaching heart attack. So, what else should raise our concern? Another common sign is heart palpitations. That is, a heartbeat that feels too fast or too strong. According to a 2023 study, heart palpitations can indicate a heart attack in the coming days or weeks in up to 42% of people. Next, a red flag should go up the moment we notice shortness of breath, difficulty catching our breath. It is estimated that shortness of breath occurs before a heart attack in up to 34% of cases. What's important is that this symptom can appear not only during physical activity, but even while resting or lying down. I want to emphasize very clearly that any shortness of breath should be discussed with a doctor, because even if it's not related to an upcoming heart attack, it may still signal other serious health problems, such as heart failure or lung disease. Let's move on. So far, we've talked about the more specific symptoms that should always be treated as potential warning signs. Signals that our health and even our life may be in danger due to a possible heart attack. However, I would now like to draw your attention to less specific, less obvious warning signs, the kind that we rarely associate with heart problems, though we absolutely should. First on that list is fatigue. I understand, of course, that in today's world, everyone feels tired or overworked to some extent. But when fatigue becomes unusual or extreme and persists even after rest, it should make us stop and think. Studies show that a feeling of unusual fatigue appears in up to 62% of patients who will experience a heart attack within a few days or even weeks. Interestingly, fatigue as a prodromal symptom of heart attack is observed much more often in women, and in many cases, it is actually their main early sign of an approaching cardiac event. That's why, ladies, it's especially important for you to pay close attention to how you feel, because a noticeable change in your overall well-being may indicate serious health problems. Another unusual symptom that can potentially warn of an approaching heart attack is sleep disturbance. Around 22% of people report this issue overall, and nearly 50% of those cases occur among women. Of course, we should remember that many different factors can cause sleep problems. However, if you maintain good sleep hygiene, avoid caffeine in the afternoon and evening, stay away from screens before bedtime, and still experience difficulty falling asleep, it's worth consulting your doctor. A similar situation applies to another warning sign: anxiety. Researchers have found that anxiety occurs in about 26% of patients before a heart attack. That's why any sudden, unexplained feeling of fear or restlessness that lasts for an extended period should be treated as a possible warning signal that something may be wrong with your heart. Moving on, another common symptom of an approaching heart attack, occurring in about 22% of patients, includes nausea, vomiting, or unexplained indigestion. What causes this? What does the heart have to do with the stomach? Well, it is believed that during heart ischemia, which begins even before a heart attack, the heart muscle cells gradually start to die. As this process occurs, various chemical substances are released into the bloodstream, which then stimulate the vagus nerve near the heart. This signal is sent to the back part of the brain, where it is misinterpreted as stomach discomfort or digestive issues. As a result, the brain activates defense mechanisms aimed at protecting the body from what it interprets as potential food poisoning, causing nausea and in some cases vomiting. Finally, I would like to mention swelling of the ankles and legs, which can also appear several weeks before an acute heart attack. When the heart becomes significantly deprived of oxygen, for example due to plaque buildup consisting of cholesterol, calcium, or inflammatory cells in the arteries, it can no longer pump blood efficiently throughout the body. This leads to blood pooling in the veins, especially in the lower limbs, which manifests as swelling of the ankles and legs. These swellings are usually more noticeable at the end of the day, particularly after prolonged standing or sitting. As you can see, the warning signs of a heart attack can vary greatly. It is further complicated by the fact that one person may experience several of these prodromal and more specific symptoms, such as chest pain or heart palpitations, while another may have only a single, non-specific symptom, like sudden fatigue or anxiety. Unfortunately, there is no clear pattern. What's truly important is the awareness that, in most cases, a heart attack does not come out of nowhere. Many people could avoid a heart attack if they simply reacted in time to the warning signs their body was sending. That's why I strongly encourage you to pay closer attention to your body, to how you feel, and to have regular preventive checkups, which help detect problems early and allow for timely treatment. And that's the final thought for today's video. If this video gave you even one helpful tip, consider subscribing. It's the easiest way to support this channel and make sure you find more practical advice right when you need it.